Okay. So first I want to get a little bit of your background. Can you tell me about yourself and what you like to do outside of the hospital?
Yeah, so I was born in 1971, Texas. Moved to Colorado when I was 3. So I really grew up in Colorado. Moved to New Mexico in 2016 after Colorado became too crowded and crazy like that.
Yeah.
I really love the outdoors. Whether it's hiking, off-roading, and I don't mean like off-roading like climbing
Rocks and stuff.
but just going off the beaten path. And
Yeah.
some of the roads out here that are pretty incredible. Like on top of Lava Mesa,
Mm-hmm.
you can go up there and it's just impressive.
It's even more fun when there's
Yeah,
mud.
I have a Bronco, so I love doing that. I cycle.
By the way, that's my favorite vehicle, and I want one of these days. Old or new.
Yeah, it's a 25 Raptor. It's
Nice.
It's just, it goes anywhere. It's like a hovercraft. It's
Yeah.
so smooth too.
Oh, I can't wait.
I cycle. Gotta go with my wife sometimes, but she's working now as a nurse, so she's she's working nights and she's adjusting to it and all that. So she hasn't gone with us as much. But her dad, my father-in-law, we go fairly often.
Cool.
I have a 3-wheeled trek where you're sitting down almost. It's 2 wheels in the front and 1 in the back.
Oh boy.
You pedal like a
Yeah.
bike, but you're just instead of sitting upright. And it's great. It doesn't hurt your back. You're just
I've seen some people on tramway driving those.
Pull over on the side of the road and just take a nap sitting on the bicycle.
It's like a zero gravity chair.
Right. I'm just exploring parts of the state I haven't seen, and there's tons of New Mexico I have not seen yet.
Yeah, there's tons of New Mexico I haven't seen yet, and I've lived here all my life.
I like reading.
If you gotta get it, it's okay. Okay.
For all the nurses, actually. Reading, just relaxing at home. I'm kind of a homebody. I don't have to be out and about.
Yeah.
Tons of people all the time. My wife's the same way, so.
Well, you're around tons of people all the time at work, so I can imagine.
We live in Cochiti Lake, so it's nice being out off the beaten path. We're like a mile from the lake. I can walk down there.
Wow.
And it's quiet.
That's very nice. That sounds
kind of
amazing.
my interests, I would say.
Okay.
Sports. I'm a huge Bronco, Rocky Avalanche, Colorado team.
True Coloradian. So, were you interested in transplant nursing before your kidney transplant, or did your experience influence your career path? Can you tell me a little bit about how that happened?
I was not really interested in it before. At the time, immediately, within a few years before I ended up on dialysis, I was working in IT at IBM in Boulder, Colorado. And as I ended up on dialysis, and I had always thought about being a nurse. My mom's she's passed away now, but was a retired hospice nurse. I have cousins that are nurses. My grandmother was a nurse.
It runs in the family.
So I'd become interested in it, and I decided just to go for it. So I started nursing school while I was on dialysis. And then my transplant happened right in the middle of nursing school.
Oh,
so
wow.
I was able to finish, and then became a dialysis nurse. So I worked in dialysis for like 15 years.
Oh, wow.
But I'd always wanted to work in transplant. There weren't any openings. A lot of people stick around with this. There weren't too many openings.
I imagine it's a pretty rewarding career.
When I saw the one for this, I just jumped on it. And so then I started here in October of 22. Yeah, October of 22. And then I continued to work like per diem in dialysis for another couple of years while I worked here full time. I'd work like 2 shifts a month because it just was hard to let go of. I've done it so long. Once we paid for her last semester of nursing school, I quit because we were doing that also because I didn't want to borrow student loans.
No, I don't either.
Off. I don't have any, and we paid them off, and we're not going to borrow a bunch of money. So we didn't. And so so once she finished, we paid for her last year's tuition in her semester in nursing school. I resigned that. So I've done just this for like the last 2 years or so.
Okay.
And she's now, like I said, working as a nurse here at Pres on the neuroprogressive care unit night shift.
Wow.
She works nights. So
I can't wait to be here.
We pass each other, and we literally have passed each other. Like I'm walking out of the parking garage, and she's coming up the hill.
That sounds interesting.
But, yeah.
So you don't have to tell me this or not, but can you tell me a little bit about your kidney transplant journey? Like, maybe what caused it and what
Yeah, so I had
landed you here?
some really crazy high blood pressure that they didn't really completely figure out. I mean, because it started in my late 20s.
Mm-hmm.
And usually somebody doesn't have blood pressure that high that young. And
Right.
some of it was lifestyle. Like I partied, I did all that. For a while, had like 3 times a day McDonald's diet, which is just not good for you.
Yeah.
So much salt. I mean, and so it was, that's kind of what preceded. It was high blood pressure. But and then when I ended up finally in kidney failure, they biopsied and it was really inconclusive. They really still didn't have an answer.
Really?
What caused it to be so high, at a younger age. So, but yeah, it all ended with me. I knew something was wrong. I went to the ER and my blood pressure was 268 over 140. They put me straight into the ICU. All the IV blood pressure medicine, all that, and then they said, "Oh, your kidneys are
Failing."
Yeah.
Wow.
Shock. You never know.
Yeah.
Never know.
When I got that news, I mean, I knew it was coming because of the lupus, but you're never ready for it.
Yeah,
Never.
It was blindsided me. So it was hard at first. The dialysis journey, I was, like this is awful. I hate this. It's real down.
It's tough.
I never would say I ever felt suicidal, but just doom and gloom.
Mm-hmm.
And then it was the thought of going into nursing that really helped drive the outcome of getting that. And I did everything they said I needed to do to get on the transplant list. And when the call came, I was out eating dinner with friends. I was trying to do a normal thing, and they said come down. So my donor was a 17-year-old girl, which is sad. She was deceased, not live. Wasn't a live donor. But how they match those 6 human or HLAs or antibodies that we use to match people. You can do a transplant with none of them matching. It just means sometimes you need more medication to prevent rejection. All 6 of them matched, and that's really rare.
Wow.
And she was where she was hospitalized. After whatever accident she had, she went to University of Colorado Hospital, which is also where the transplant center is.
Mm-hmm.
So they told me later, your transplant was almost like a live donor because we just had to recover her organs and walk them to the other side of the operating room.
Yeah.
Versus like sometimes they could be on the other side of the state and they get put on either in a car or on a plane and flown and then the surgery's done. So it worked right away, and I've been blessed. I mean, I've had no rejection. My labs have been like this the whole time. There's creatinine of 0.9 just the entire time.
That's nice.
Like a month ago, and they're right there still. I did, however, have a skin cancer because the medication makes you more at risk for skin cancer. It was on my forehead in 2014. That was when so I did Mohs surgery, where they cut what they think is there, then they do a biopsy, and then if they think there's still more, then they'll cut even more. And it's just, oh, God, it was no fun.
Yeah, I can imagine.
And then I also developed something that people that are on long-term immunosuppression sometimes can develop called post-transplant lymphoproliferative disorder. And what that means is certain B cells or immune cells can clump together and form these. It's not cancer, and it's not a lymphoma, but they reproduce a lot like they do in a lymphoma. If that makes any lymphoma is considered an actual cancer. This is not, although it's treated by an oncologist. And I discovered it by I'd been sick and I wanted to make sure I didn't have pneumonia, so I went to my primary care and they did a chest X-ray. And he saw a space about the size of a dime, the lower lobe of my left lung. He said, "I don't like to look at this," and he sent me for a CT. And when they did the CT, they said, "We need to biopsy this." So then I had what's called a bronchoscopy, where they go down your airway with a tool that can find the spot and then biopsy it. They knock you out, and so it's not really surgery, but you're unconscious. And they send it off to Mayo Clinic, and they said it's a B cell proliferation. So what ended up happening is they switched my medication. They took me off the tacrolimus and the Myfortic and put me on something called sirolimus or rapamune. It's another immunosuppression. It's not first line, though. They don't like to use it, especially right after transplant, because it's not as potent. But in my case, because I had a really good match and my course had been no rejection throughout the course, they switched me. So still to this day, all I take is that and prednisone. I don't take any Myfortic, because that's the big culprit. And tacrolimus to a lesser degree, but Myfortic can be the culprit behind that.
Myfortic is rough on me.
It is, yeah. The GI. I mean, when I first had my transplant, they put me on Cellcept, which is the
Mm-hmm.
their older version of the same drug, and that one is horrible. I have diarrhea constantly, so they switched me, and it would come and go. And it was just like, oh,
Been on that too because of the lupus, so I understand what that is.
But it's good. I mean, Myfortic is like a double. You get a double impact though. It helps with the transplant, and it also helps control lupus. So so being on some level, I mean, is important. But
I have been doing good because of that.
Yeah. So you haven't
had
flares.
much.
I bet you haven't. Yeah.
I've had one.
Yeah.
And that was it.
Yeah, and you said you have a rheumatologist, so they know they used to. So those are the only kind of hiccups in my whole transplant course. It's been the whole time, and then just this last July 7th was 19 years. So
that's very cool.
7/7 of 07 is when the transplant was.
7/7 of 07. Yeah. Wow.
And that wasn't planned. I mean, that was not a planned thing. So.
Yeah. Mine was January 13th, 2022.
Yeah, yours I remember. So that was I had the beginning of the year. That was early on.
I wanted
you and another girl got the same
from
the same donor.
Yeah, and I heard she's doing well too.
Yeah, she's doing great. She's working and back to whatever is.
Yeah. So I'm very glad that I got to speak to you about this stuff. Did you have a difficult recovery after your transplant, or was it pretty easy getting back?
It was pretty easy. I didn't, I was in nursing school in the middle of it, and the transplant clinic, because it was so soon, that process, and the last semester of nursing school, they wanted me to drop out. I was like, I'm not doing that. So we got to come up with some kind of plan.
Yeah.
Whether you're going to fire me and make me go to a different transplant center, I don't care. I'm not quitting nursing school. So the agreement was I had to wear a mask at school. This is before COVID, so I was walking around with a surgical mask on.
Yeah.
Still be wearing, just recent kidney transplant. So I was back in class 2 weeks after the surgery.
You are tough.
I was like,
I had such a hard time.
God, I know. And I was careful. I didn't lift anything. I followed all the, and I was good about keeping the mask on. And I've never had any major infections. Knock on wood, I never got COVID because I was working in acute dialysis, dialyzing COVID patients that were dying right in front of me. I mean, they were all on ventilators, and it was awful. I sometimes think I might even have some PTS from it.
I do.
People literally, it's like knowing nothing I'm doing is going to help this person. It's not going to save them. We're just doing it to tell the family we've done everything. Their kidneys are now failing. So
when I was going through it, it was the most horrible experience of my life. I was so absolutely weak. I saw so many people die while I was there. It scared the hell out of me, and I felt like I was dying because I had absolutely no energy. And it was scary. I didn't know if I was going to wake up the next day, kind of a thing,
Yeah.
So I totally understand that experience. And I know some people have completely different experiences where it's not so bad, and they're only there for a little while, and they get to move on.
Yeah, and then so no, I didn't have really any complications or complicated course. It was just that I think I get sick less often than most people I know. What I have noticed is it takes me longer to recover from it. Like my wife and I got the same cold last year, and she was well 3 days before me. I'm still hanging out. But then other than that, it's not. And like I said, I haven't had any big infections. So that's where everybody always worries about that. Not even a UTI, which is a shock. But guys don't get them as much.
Yeah.
And I take cranberry and D-mannose. I've been taking it since the transplant. One of the transplant doctors in Colorado was like, this is what we have a lot of our patients do because it's harmless. So that's not going to interact with your medications. I mean, it's the two very natural
and prevents
things.
The UTIs.
And Sprouts has a version of it. It's just combined. It's
cranberry
and D-mannose in the same capsules.
Oh, cool.
So I still take them every day. And I think that might have helped prevent me getting a UTI.
I might think about that.
I know Dr. Barantes puts half the patients on it.
Oh, really?
Had UTIs,
Yeah.
It's supported by the docs here. So
I'll ask the next time I'm in then. So how has being a transplant recipient made you a different nurse?
This is most people when I explain this understand and agree, but it's kind of a unique way of looking at it. But I even as a kid, I've always been a pretty compassionate, empathetic kind of person. Seeing somebody bullied always bothered me. I got in a lot of fights in school because I was sticking up for guys who were getting bullied, and I got bullied a little bit too because I was like the skate rock, punk rock, skate rock guy in junior high and high school. So we were different. We always got picked on, but I just was not going to let, even if it meant fighting over it. It just always bothered me. But once I got the kidney, that degree of empathy was really magnified. Like I could see a scene in a movie and I'm bawling. And I think that's the feminine ability to be more in touch with emotions and psyche and that kind of thing than men.
Right.
It is. It's just it's a true thing. Women, not that all women are empathetic and all that, but they are more apt to be in touch with it. So that I think I got that from my daughter. I think that was transmitted from her.
Oh, really?
Me because I have her kidney inside my body. Really. And
I did feel different too.
That did change it because I just started like really relating with patients when they're sharing something some of it's my own experience. Like I've been through what they've through, whether they were on dialysis or whether it was transplant, but it was just magnified, and that was a big thing. So that was my thing about did it change how I would become a nurse? It's just making. I think I'm more compassionate and empathetic than I was because of it. And
well, that definitely makes sense. I mean, being a lupus patient, I feel like I've gotten the same training.
Well, and they say that like they say that what I just was talking about, they frequently attribute that to heart transplants because that's like the seat of the soul. The heart.
Right.
You get a heart transplant from somebody, and you're gonna start liking food that you never liked before because it's that person. I can't think of any food like that I suddenly liked, but definitely the like connection with patients is way stronger.
That's was going to be the next question I asked. Actually, was how do patients respond differently when they learn that you've been a kidney transplant yourself?
I think so. I think patients can feel like they can be more open, because it's like they're not afraid of me not understanding what they're talking about. They think, you probably have had the same thing happen. Dialysis too, because I did in-center dialysis the whole time, and man, some of the patients they get so discouraged. It's like I don't want to do this anymore, or they're just down all the time. And I would always talk about like, well, let's maybe talk about having some goals, developing like some kind of new hobby that like distracts you from how bad you feel physically and all that stuff, and that really helped a lot of them. And that's what I did. Because I wasn't going to remain in that doom and gloom space that I was talking about. I was like, that's not going to do any good. I want to get through this. I want to get my transplant. I want to get off dialysis. I want to do all that. And, so it's doing that. So you get definitely a connection like that.
What would you say are the biggest misconceptions people have about kidney transplants or transplants in general?
That's got to be probably people don't think that doctors will fight as hard to save their life. There's even been stuff in the news about kind of like that kind of thing. After somebody's like on a ventilator, and they're on life support, a lot of people think, the doctors are just going to go, they make a great organ donor. Let's just not, and that's totally not true.
Yeah.
So it's just huge. A lot of people discover that once they actually, know somebody who then becomes an organ donor and all that kind of thing. And then, that's probably the biggest one. And then sometimes I think there have been times where people thought that the race had to do with it. Because they used to specify whether someone was African American or not when they figured out their GFR, their kidney function.
Right.
And they don't do that anymore because people just thought, if you're African American, you're not going to work as hard. You'll be at the back of the line.
Yeah.
And that's just not true. That's one of those things. That's not how UNOS works. It's just not.
I'm glad UNOS.
Being involved in because I can actually log into UNOS and I can see all that. We don't ever see donors' names. They have a donor ID and that's it. You don't see their name or any of that information. But you see all the race information and what happened to them. There's a little bit about that.
Yeah.
And it just I've never seen that kind of thing.
How many people do you think are waiting for a kidney transplant in the United States?
In the United States, almost 200,000, I think.
Because I have met so many people just going back to school of people who have had transplants.
Yeah, that's cool.
Yeah, so it's like...
Yeah, I think that's the statistic. It's about 188,000. Dr. LaRue or Dr. Wilson would know.
Okay.
Because they're always at the UNOS conferences and stuff
like
that.
Right.
American Society of Transplant Surgeons, and they always have all that updated information. there's more and more people. I mean, it goes along with type 2 diabetes.
Mm,
People waiting for transplants.
right.
People on
That makes
dialysis.
sense. Yeah.
It just goes up, you know. And, I think, but that's I mean, it's those are the two misconceptions I would say.
Okay.
Those two.
Okay. So now I'm going to hit on the emotional side of things.
Sure.
How did receiving the transplant affect your outlook on life?
Night and day, improvement and optimistic outlook. I mean, I kind of, because I got through nursing school, and started in nursing, only not even a year, like 11 months after I actually started working as a nurse in dialysis. So it was like, and I just, I wasn't sure, or right before, like during nursing school and right at first, but it became pretty obvious to me that it was my calling, and then so that's driven the optimism. And it's like I can do anything if I can be on dialysis 3 days a week and get through nursing school at the same time, then I can do anything.
Yeah.
Because it's freaking hard. I did
I would say
clinicals on the
so.
weekends because I was a Monday, Wednesday, Friday evening dialysis.
Uh-huh.
So I did it from like 5 to 9 p.m. I
Wow.
would go home and pass out. And I would have class during the day, during the week, and I do my clinicals on the weekends. So the school is like, I had the school as Denver College of Nursing. They were really good about helping me
Navigate that whole thing.
adapting to me being, and they would invite me back to talk to some of the med surg classes during school about nephrology.
Right.
So I was from both sides.
Yeah.
Like guest lecture, kind of.
Do you think that your transplant changed your priorities and goals in life?
Yeah, really health wise. Not that I haven't had some health struggles. Like I had a new diagnosis of AFib after, and I'm pretty sure, I can't prove it, but I'm pretty sure it was from the Moderna COVID shot. The Pfizer one never made me have some weird heart thing.
I did that too, and I had a heart attack 4 months later.
Yeah.
And you can't prove it, but
yeah, I can't prove this either. But it was 2 days after getting the shot,
mm-hmm.
and I never had anything like that. And it's more or less resolved now. Like I've never had any runs or noticed it. I did one of those 4-day heart monitor things,
Mm-hmm.
and they saw very little activity on it. So, but yeah, so it's that. I mean, man, just.
So looking back, what advice would you give yourself before the transplant?
Before the transplant itself, well, kind of like what I think more of is like, it would almost be like, what advice should I give myself before kidney failure? But it's more just take care of yourself, because that's going to make you the most successful at it. That's what's going to make the kidney last as long as it possibly can. Is like I still check my blood pressure twice a day, just like patients right after transplant.
Right, yeah.
Religiously.
I do too.
And I don't skip medications. I have missed a dose of medication probably twice.
I tend to be
and
a little
it
late.
freaked me out. Late is okay. So late's not a big deal, as long as it's not right before lab. I mean, if you because then it'll affect the trough, because it
Right.
needs to be 12 hours apart between doses.
Right.
If you're closer, then the level's higher,
Mm-hmm.
and then it may be, your tacrolimus level's high. Well, no, it's probably not really. It's just the doses were taken close together.
Right.
But you're not at any bigger risk of rejection for taking one dose of the day a little bit late.
Yeah. It's like 1 hour to 2 hours late
Yeah.
sometimes.
Sometimes you have to see Rapamune, the drug I take. Sirolimus is only once a day. You only take it in the morning. And I've taken it at like 9 o'clock before, 8:45, 9 o'clock, that kind of thing. And Dr. Kurios is my doctor, so and I so told her, it's late. I mean, you think that's a big deal? She said, well, not really. It's just if unless it's the night, the day before your labs. If you do the labs the next morning, then you may have an artificially high sirolimus level. So no.
Well, that is good advice.
That's the yeah, but that's that was kind of that question being what would I tell myself right before transplant is take care of yourself, because if you do that, you're gonna get all the benefit from having the kidney for the longest time possible. And that's just proven over and over and over and over again.
Take your medicine, eat well, drink your water.
Right. Try to be active. Don't go be a Olympic bodybuilder or anything, but Like I
Don't be a
cycle,
couch potato.
Yeah, I have a Peloton treadmill, a Peloton bike. We converted our garage into a gym because we got all this equipment during COVID, and we actually had a guy help us put down like 3/4 of the garage is gym mat
Oh,
with our equipment, and then the other, I have tools and stuff like that. So we don't park our cars in there, we got one of those split level heater air conditioning units, so it's climate controlled too. So it can be 100 degrees outside and it's 72 in the garage.
I've been trying to talk my grandma into getting one of those for her house. The swamp cooler does nothing.
No, the split levels are nice because then the compressor and everything's outside or on the side of the house, and then it's up, and the big hose things go inside, and then the unit's right on the other side of the wall.
Yeah,
and it works great. It has a remote. You can set, you can set a timer. You can set, just like a regular thermostat. You can set a high and a low range. It works great.
And is it loud?
No,
Can you hear it?
You can barely hear it. It's cool. It's really cool.
That's very cool.
Split level is the key. You can't afford to do the full, because we have central also, but it's in the house only, not in the garage.
Right.
And it's the rooftop kind of, but it's an actual AC. It's not a swamp cooler. It's an actual AC.
Yeah.
But because living in New Mexico with no AC would be brutal.
Oh gosh, I hear that a lot of people die in Europe because they don't have air conditioning.
We have this heat wave now. It's international.
Yeah. Wow. Is there anything that I haven't asked you that you think is important for people to know?
About just in general about transplant?
Or health or anything that has to go along?
Just people get so like, I feel great, I don't need to see a doctor, all that. And just see a doctor once a year, just for blood work and, physical and all that. I mean, because early detection is the key. Detecting somebody has kidney disease early is the key. Like say they're like at stage 3. Well, you can make lifestyle and diet changes at that point that will prolong how long those your kidneys are actually going to last before you need dialysis, if at all. Some people live out the rest of their life in stage 3 kidney disease, and it just doesn't progress because of the changes they make. And that's only due to seeing a doctor and getting lab work. I mean, so things like that. I try to. I'm a glass half full versus glass half empty kind of person. So it's trying to help people understand that you have the power to change things, for your own health and for your own as far as transplant goes. And
well, in anything really, I guess.
Right.
You do have the power. You have to tap into that.
And it's real easy to be. I mean, because I understand, believe me, because I've had. I take an antidepressant. I've had depression, on and off for a long, long time. It runs in my family. And it's just being willing. Like I don't want to give in to that. I would rather turn it around. And whatever that means. It means working with a therapist, being on some kind of medication. All it takes is Talpram, and it's a pretty small dose of it. So my wife does too. I mean, both of us struggle with it. And so it's just having that optimistic, glass half full look.
That's good.
About all transplant and health and all that.
Okay, last question. If you could change one thing about kidney transplant care or the healthcare system, what would it be and why? I know there's a lot.
The biggest one, and this is my soapbox, in healthcare in general, is everyone, no matter wealth or where you're from, whatever that, having access to all of the healthcare that they need, prescriptions and the medications, and being able to get medical care related to transplant. It's difficult sometimes. I mean, and that's a large part of that is insurance companies, and I'm a national healthcare 100% advocate. So
Same
and
here.
I'm I'm not necessarily it should be 100% run by the government, but it shouldn't be for profit.
Right.
I mean, there should not be a reason that anything in medicine is for profit.
To save somebody's life is not for
profit off of people's illness. You're going to profit off of somebody being sick. And what that ends up doing is that they don't put all that research and money into cures. They put it into medications to treat the symptom, but not the cause of the illness. And it's I have a good friend. She's dual U.S. and Norwegian citizen, and she talks about healthcare over there, and it's like you'll never see somebody over there that's filed bankruptcy because of medical debt. You'll never see somebody over there that can't pay for prescriptions, that has to decide, do I fill my prescription or do I pay my electric bill?
Right.
It's just not. They, the healthcare is national healthcare. They pay little to nothing for any kind of healthcare thing. They pay some for medications, but it's like, $5, $10. It's not, $900 a month for insulin.
Right.
It costs pennies to make. I mean, it's just I really believe it's a racket.
It is.
It's just.
I agree with you on
that. But and I've seen the effects of that on transplant patients. The ones that like can't pay for this whatever insurance they have. I'm like, well, you lose your insurance, you lose your medications. I mean, that's just it's backwards. You won't have somebody be able to afford their medication. So what's going to happen? They're going to lose their kidney. They're going to be back on dialysis, which Medicare will cover. But then the difference in cost is just ridiculous. I mean, how it's hundreds of thousands of dollars a year to have someone on dialysis, and it's a tiny fraction of that to pay for their goddamn medication so they can be, excuse my French.
No, I agree with you.
So they can have access to their medication and stay off dialysis and prevent them from having all that.
Yeah.
It's like there's Tanya, my Norwegian friend. She just says they have preventative care. They can see a doctor anytime they need it. And it's not going to bankrupt them. They get. I mean, new fathers get 8 weeks of paternity leave in Norway, like the mother and the father, so that both parents are at home at the same time. I mean, I don't know. They're like the happiest population in the world. Almost every year.
I have
one of the
heard
Scandinavian
that.
countries.
Yeah, and I've like done a little research, done a little YouTube videos on it.
Oh, it's my ancestors. Well, mom's side of the family is German and Norwegian, so I have that. And my wife's is her mom's side of the family is Swedish, so she has that background too. We want to go at some point and do like the tour of Finland, Sweden, Norway, and Denmark. That whole
that whole little section.
It's just.
There's so much history there too.
Yeah, I love it.
I love history.
And I love mythology, so I'm really versed on like the Norse mythology, the different traditions and all that. It's cool. That's the whole with dialysis that I think could change. And there's a secondary to that is kind of related still, but I wish they would cover the transplant drugs for the life of the kidney, and that right now it's 3 years.
Really?
You have to have some kind of other insurance. And most people do. I mean, if you're, because you have Medicare for 3 years after the transplant. And then after that, Medicare stops paying the 80% of the medication or whatever. And then you usually have to have Medicaid or something else. And it's been before Congress before and it's been shot down. So, they've tried to get that law passed where, Medicare.
That's because they don't want the insurance companies to disappear.
Yeah.
They're all in cahoots.
Yeah, they are. The fact that we pay 10 times what a Canadian pays for the exact same drug is criminal. It's criminal.
And that's a government thing here.
It's awful. It pisses me off.
America.
Yeah. Like we're so great.
I know.
You saw my Facebook profile, you would understand. It's so bad.
Well, that's all I have.
Yep.
Okay. So first I want to get a little bit of your background. Can you tell me about yourself and what you like to do outside of the hospital?
Yeah, so I was born in 1971, Texas. Moved to Colorado when I was 3. So I really grew up in Colorado. Moved to New Mexico in 2016 after Colorado became too crowded and crazy.
Yeah.
I really love the outdoors. Whether it's hiking, off-roading, I don't